All right, David, thanks so much. After months of steady declines in COVID numbers, the CDC is seeing signs of a late summer COVID wave. And we have Dr. Desmar Walks, medical director from Austin Public Health, joining us here in the studio to really check in on where Austin stands in the summer bump in cases. So thank you, first of all, for being here. It's good to have you in person.
Yeah, it's nice to see you. Thank you for having me.
So let's talk about the cases that we're seeing this summer. Should we be concerned here in Central Texas?
We're seeing a slight uptick at the health department. We're just following trends, but we also want to get out here and tell people we kind of got a little bit of relaxation in masking and distancing and that sort of thing. And just want to remind people as we have transitioned to this new normal place that we still need to do the things that we know work to prevent ourselves from getting sick and keeping us from spreading disease in the community, get vaccinated, mask, distance, that sort of thing.
Okay, and we'll get to vaccinations in just a moment. As we see this bump in cases, are we seeing any hospitalizations?
We are seeing a slight increase in hospitalizations.
Okay.
It's nothing that's overwhelming our healthcare system, but again, we just want people to be aware of the fact that COVID's still out there.
Absolutely. And then we're talking about wastewater, and you all are using that to monitor the situation. What does that process look like?
So when you have COVID-19, you can shed that virus in your feces. And so we're collecting samples of raw sewage from treatment plants, processing it, and following the concentrations of virus in the sewage.
Okay, and the APH newsletter came out today. You're talking about boosters and vaccinations and boosters. Can you just give us some guidance on that for people at home who are watching who maybe haven't had their vaccinations, or they have and they wonder, should I get it again? What's the guidance on that?
It's gotten a lot simpler.
Okay, which is good.
One bivalent shot, if you're over the age of 6, would make you put you in that up-to-date category. For people who are over the age of 65, there's an option to have an additional booster after the 4-month period of that first booster shot. And if somebody is immunocompromised at higher risk for developing COVID, they can also get a second booster shot at 2 months after that first booster shot. So it's a lot simpler now.
Okay, and then for people, we're having summer events, barbecues, some events though might be indoors. Should people be masking? I mean, we're so used to what we've been doing the last year or so. So what should we be doing to take those precautions?
Ventilation, ventilation, ventilation. And then assess your risk based upon where you are. If you're somebody at high risk and you're going into a crowded indoor situation with poor ventilation, don't know who's there and whether or not they're sick, you could take that extra precaution of wearing a mask. If you're somebody who lives with somebody who's at high risk and you're in that same situation, you may consider wearing a mask. But above all, we just want to respect people's choice to wear a mask and have that extra layer of protection.
Okay, Dr. Desmar Walks, as always, it's good to have you, and we'll have the guidance that you all put in your newsletter on our website at kxan.com. Well, coming up, the sweeping